Welcome to angina.org. This website was written by renowned experts and pioneers of patient-centered angina care, and we're very grateful to patients and carers who know what it's like to suffer with this condition, because they've helped us a very great deal. Angina.org is designed to help you understand angina and the treatment options that are available so that you can actively participate in your own care. The idea of working in partnership with doctors can seem scary, especially if you don't have a basic understanding of the issues. Angina.org is designed for angina sufferers who want to be more involved in the decisions, and if that's not you, there are other websites that might help. The thing about education is that it works. Educated patients live longer, they have a better quality of life, they experience fewer side effects, and are more likely to avoid undergoing an unnecessary procedure. The process of learning about angina is like putting together a 1,000-piece jigsaw puzzle. The difference is that you don't have a clear picture to guide you. Consequently, it's easy to get the corner bits wrong, and if you do, the whole puzzle becomes confusing. Take this very simple 4-piece puzzle. If you have this image in your mind, then the solution to the puzzle is straightforward. But another patient might have a different image in their mind. That would result in a completely different solution. Both seem equally plausible, and it depends on the perspective of the person solving the riddle. Let's see how you've done over the years in learning about angina and its treatments. But let's start with an understanding that everybody has a basic belief system about angina. And this is the British Heart Foundation poster campaign image of a man suffering from angina and possibly having a heart attack. For the next 3 statements, I'd invite you to choose either true or false. First statement: the heart is damaged by repeated episodes of angina. Is that true or false? Statement 2: unblocking a severe narrowing halfway down an artery is safer than leaving it alone. True or false? And then lastly, aspirin helps blood to flow past narrowings by thinning the blood. Here are an expert cardiologist's answers. Statement 1, the heart is damaged by repeated episodes of angina. Statement 2 was that unblocking a severe narrowing halfway down is safer than leaving it alone. And statement 3 was that aspirin helps the blood to flow past narrowings by thinning it. If you got these answers wrong, it is probably either you're incapable of learning, or far more likely you weren't taught properly in the first place. The problem is usually poor health education by health professionals. An expert group of American cardiologists looked at this a number of years ago. They concluded that because the presentation of ischemic heart disease is often dramatic, and because of impressive recent technological advances, healthcare providers were tending to focus on diagnostic and therapeutic interventions, often at the expense of critically important aspects of high-quality care. The group concluded that the chief among these neglected areas was the education of patients. I think the problem is that doctors are confused about the difference between educating and informing a patient. The reality is that the two things are worlds apart. It's easy to inform a patient over a series of clinics, even using different doctors. But to educate a patient is a much more complicated process. All patients have experienced turning up into a clinic and to be given snippets of information by different doctors at different times, which they then have to go away and make sense of. And often that results in misunderstandings. At angina.org, we want to avoid that. And so you'll notice that it is organised differently from other websites. We believe that unless you have a solid understanding of the basics, you may very well fall into the trap of putting together the jigsaw puzzle pieces wrongly if you browse the internet. And therefore we discourage browsing until patients have had the good grounding in the condition. If you'd like to enrol in the e-learning education programme, which is based upon the award-winning National Refractory Angina Centre, follow the Virtual Angina Education link at www.angina.org. Thanks for taking the time.